Do you see the world of neurotech being different today than it was 10 years ago?
When there is huge companies right now between Nevro, Inspire Medical that have built huge neurostim products with huge revenue right now. Everybody wants to be on the mezzanine around for Nevro. Similar stories, obviously, for Inspire that does the OSA. So there's a lot of bright examples right now that you can actually build a business. You can actually challenge the incumbents like Boston Scientific, Abbott, Medtronic. That's been proven, especially now that we have a better understanding that we can have even higher level effects. And the science has progressed to the point that we're looking at treating inflammation. We're looking about autoimmune disease. There's companies with implantables or wearables that are looking to peel back or retrain the brain to better control immune response. And we know the pathway, it's understood. There's implantable data that shows that you can actually move it from one side to the other side of the equilibrium. So scientifically, there's so much progress with different tools, expanded tools, even, on the sensing side, on the actually coupling to nerves or the brain, and kind of really our understanding, in my view, of this two level of opportunities. One is the high bandwidth opportunities, the Utah array, the Neuralink, and all of these applications that you need that high bandwidth, and it's moving. I mean, there is real progress and real results that have to come out of it. And then there's more of the system problems like chronic pain or chronic inflammation, where we're really talking about network effects, memory effects that build over time that you can address it with a different tool set. So the science has progressed. I think you need a couple more products to the market with success so we can advance the discussion. The fact that you even see technology companies start getting into disease prevention, that to me is an interesting first step, because after prevention, diagnostic prevention, you go to actually therapeutic prevention, stopping the disease from developing. So to me, that's kind of, if we can actually have an impact there, it's not going to be the end. It's going to start making inroads into that area to start preventing and slowing down decay. Then I think everybody will recognize the potential here. So as long as we see enough potential for people demonstrated with data, the potential that it is there, then we'll get the opportunity to keep going at it. And then we'll talk about the next 10 years.
And I'd also like to add what I should have commented that I also see in the next 5 years, and that is a much, much more effective means of gathering and analyzing data for overall improvement of patient care. And I think that is very real and very realistic in terms of being able to be accomplished. In fact, if anything, that should be at the fore, the earlier part of that 5-year period, because that's a matter of stuff that's available to us now and putting it together.
And just to add to that and echo it is also, Frank, a company that a good friend of mine co-founded a couple of years ago, just been rebranded, I think, as Huma, and started as MedOpad. The idea was, let's take the iPad, let's bring it into the hospital environment and make everything and all data much more accessible, has turned into one of the most exciting healthcare companies. And I know they've just rebranded. And I am really looking forward to that level of efficiency in the hospital setup. And what's great to see is it's not just a tech company from Silicon Valley that's trying to change how we behave, but it's the more conservative elements in the economy taking it up and saying, we need this. We need this kind of change. We need this easier flow of data and better patient care. So I would echo what Frank just said. What our challenge is to create the bridge and clarify to the listener that what you and I are talking about has an unstoppable momentum about it.